something that's, kind of bitchy.
Pretty bitchy.
Bitchy? I know. It's just, bitchy.
Well, first of all, you're a little bitchy. That's next level bitchy.
Welcome to Bitchy History, the irreverent history podcast where one history professor gets to bitch about history and the impact it has on the world today. Welcome back to Bitchy History, the show where we take history's messiest moments and show you how they're still screwing us over today. And oh boy, do I have a topic for you. Today's episode is based on a paper I wrote recently for a graduate certificate program in gender and public policy that I'm enrolled in. That's right, I went back to school again. What was I thinking? Today, we are talking about one tiny part of Project 2025, its master plan to unravel reproductive health care and social equity in the United States. So let's break it down. Project 2025 isn't just your run-of-the-mill conservative initiative. It's a full-on blueprint for overhauling the federal government to align with right-wing ideologies. Think of it as a how-to guide for dismantling progress, courtesy of the Heritage Foundation. At the center of this scheme is Mandate for Leadership, a 900-page manual that outlines their plans to reshape federal agencies and implement policies that restrict civil rights and liberties. They're not subtle about it either. Their proposals are bold, sweeping, and downright terrifying. While Trump's campaign tried to distance itself from Project 2025 publicly before the election, plenty of its architects are quietly sliding into key positions in his orbit in the next administration. Coincidence? I think not. What does this all mean? Well, Project 2025 isn't just an attack on reproductive health care, it's a calculated effort to remake the U.S. government into a tool for oppression. And Title X is one of the first dominoes that they want to knock over. To understand why Project 2025's attack on Title X is such a big deal, we need to take a quick trip back in time to the 1970s. It was an era of civil rights movements, second-wave feminism, and public health reform. Amid all of this social change, Congress passed the Public Health Service Act of 1970, which included the creation of Title X. Why? Because the U.S. was finally starting to recognize that access to family planning services was critical, not just for individual health, but for public health and economic stability. Title X was a game changer. It provided low-income individuals with access to contraception, cancer screenings, STI testing, and maternal health care, all at little to no cost. For many underserved communities, Title X-funded clinics became their only source of health care. And let's be clear, Title X wasn't just about reproductive health, it was about giving people the tools to plan their lives, whether that meant delaying parenthood so they could pursue education or career, or trying to bring a child into the world in a healthy and safe manner. And it worked. Title X clinics have helped millions of people avoid unintended pregnancies, saved countless lives through preventative care, and even reduced abortion rates by making contraception widely accessible. For example, in 2015 alone, Title X-funded services prevented over 800,000 unintended pregnancies. Since the 1970s, that's quite literally millions of people who had the chance to make choices about their own futures. But as always, progress comes with backlash. Enter the Reagan administration in the 1980s when conservatives introduced the first domestic gag rule. This policy barred Title X clinics from discussing or referring patients for abortions. The goal was clear: undermine access to comprehensive reproductive health care. And unfortunately, this pattern of attacks on Title X has repeated itself over the decades. Fast forward to 2019 when the Trump administration reinstated the gag rule. The effects were devastating. Planned Parenthood and other providers left the program rather than compromise their services. Over 1,000 clinics closed, and 6 states were left without any Title X-funded providers. By 2020, the number of people receiving Title X services had dropped by 62%. And then came the Dobbs v. Jackson decision in 2022, which overturned Roe v. Wade and left abortion access up to individual states. Title X suddenly became even more critical, one of the last remaining safety nets for affordable family planning. But as you might have guessed, conservatives weren't done yet. Project 2025 takes these past attacks and supersizes them. By reinstating the gag rule, cutting funding to Title X clinics, and pushing those funds towards crisis pregnancy centers, they're trying to dismantle the entire system. When conservatives target Title X, they aren't just going after a program, they're going after the millions of people who rely on it. And here's the thing, the people who will be hurt the most are already the ones dealing with systemic inequities in healthcare access. We're talking about women of color, LGBTQ+ individuals, low-income families, and rural communities. So let's break down the damage this will do. Let's start with women of color, particularly Black and Latino women. For decades, these groups have faced staggering disparities in healthcare. Did you know that black women are nearly 3 times more likely to die from pregnancy-related complications than white women? It's not because of biology, it's because of systemic racism in the healthcare system. Title X has been a critical tool in fighting these disparities. It provides affordable access to contraception, cancer screenings, prenatal care, the works. For Black and Latino women, especially those living in low income communities, Title X clinics are often the only option for preventative care. But Project 2025 doesn't care about closing healthcare gaps. By reinstating the gag rule and defunding providers like Planned Parenthood, these policies will rip away essential services for women of color. And where do they expect these going to go? Crisis pregnancy centers. You know, the ones that don't offer contraception, don't have licensed medical staff, and give you advice based on religious ideology instead of science. Without Title X, these disparities will only deepen. Higher maternal mortality rates, more unintended pregnancies, more women left without the care they need to live healthy, autonomous lives. It's not just cruel, it's deadly. Next up, the LGBTQ community. Title X clinics have been a safe haven for many queer and trans individuals seeking inclusive, non-judgmental care. Whether it's access to contraception, STI testing, or gender-affirming healthcare, Title X funded providers have offered services that many LGBTQ folks can't find anywhere else. Now let's look at what Project 2025 has in store for the queer community. They want to roll back federal protections by redefining sex to exclude gender identity and sexual orientation. Translation: discrimination against LGBTQ individuals will not only be allowed but baked into healthcare policy. And it doesn't stop there. Crisis pregnancy centers, the ones that Project 2025 wants to fund, are notoriously hostile to LGBTQ patients. Some won't even serve them. Others push harmful narratives about sexual orientation and gender identity. For transgender people who already face astronomical barriers to accessing healthcare, this could mean losing access to hormone therapy, STI prevention, and other life-saving treatments. The stakes are high. LGBTQ individuals already experience higher rates of untreated health issues and mental health struggles. Removing Title X's affirming care is not going to be just harmful, it is life-threatening. Low-income families are another group that will feel the brunt of Project 2025's policies. Here's the thing about poverty. It doesn't just make healthcare harder to access, it makes everything harder. And when you're struggling to pay rent or put food on the table, an unintended pregnancy can push you into an even deeper financial hole. By offering affordable contraception and family planning, it gives low-income individuals the ability to make choices about their futures. It's not just about healthcare, it's about economic stability. But if Project 2025 gets its way, these communities will lose Title X clinics and be left with crisis pregnancy centers that can't meet their needs. And let's be real, if you can't afford a $50 copay, you can't afford the alternatives that private providers might offer. The result? More unintended pregnancies, more poverty, and more families forced to rely on public assistance. And while Project 2025 loves to preach about family values, they seem completely uninterested in supporting actual families if they don't have money. Finally, let's talk about rural communities. If you think healthcare access is bad in cities, it's even worse in rural areas. Many rural residents already have to travel miles or hours to see a doctor. For them, Title X clinics are a lifeline. But Project 2025 threatens to close those clinics, leaving rural communities with even fewer options. And those crisis pregnancy centers that Project 2025 wants to fund, those do not provide the cancer screenings, prenatal care, or basic contraception that these people need. When rural communities lose Title X, the consequences ripple out: increased health risks, widening disparities between rural and urban healthcare, and a loss of stability for entire regions. Because access to healthcare isn't just a personal issue, it's a community one. So, of course, it matters who gets hurt the most by this attack on Title X, but let's zoom out for a minute. This isn't just about individual health outcomes. The proposed policies will have far-reaching social and economic impacts, hitting public health, the economy, and social stability like a wrecking ball. First up, money. Spoiler alert, it's a lot cheaper to fund Title X than to deal with the fallout of defunding it. Every dollar spent on Title X saves more than $7 in healthcare and social service costs. Why? Because access to contraception and family planning prevents unintended pregnancies. It reduces the need for prenatal care and childbirth expenses, and decreases reliance on public assistance programs, which you would think conservatives would be in favor of, seeing how they hate all those welfare queens. But if Project 2025 guts Title 10, those savings go out the window. Low-income families will be unable to afford private health care, they will face higher rates of unintended pregnancies, and those pregnancies will strain public resources like Medicaid, housing assistance, and food programs. The economic ripple effects could push even more families into poverty while draining already overstretched public systems. And let's not forget about workforce participation. Title 10 helps people plan their families, which allows them to stay in school, build careers, and contribute to the economy. Without it, more people, especially women, will be forced to leave the workforce, creating long-term economic instability. And then there's just the public health implications. Title 10 isn't just about contraception, it's about preventative care. Those clinics provide cancer screenings, STI testing, and treatment for millions of people. Without them, many patients will go without early detection for conditions like cervical and breast cancer. And untreated health issues don't just affect individuals, they affect the entire community and economy. Take STI rates, for example. Title 10 clinics are critical for testing and treating sexually transmitted infections. When those services disappear, infections spread more easily, creating public health crises that are far more expensive to address than preventative care. And here's the kicker. Communities losing these services are the ones that are already facing higher health risks. For women of color, LGBTQ plus individuals, and rural residents, losing access to affordable preventative care will worsen disparities that are already firmly entrenched in the system. Title 10 also plays a huge role in social stability. Reproductive health care isn't just about health, it's about autonomy. When people can make informed decisions about if and when to have children, they have a better chance of pursuing education, building careers, and achieving financial independence. Now imagine taking that away. If Project 2025 succeeds in gutting this program, unintended pregnancies will skyrocket, and for young people, especially those in low-income communities, this will mean dropping out of school, delaying career goals, or becoming stuck in cycles of poverty. These aren't just individual setbacks, they will hurt the entire community. Communities thrive when their members can access the resources they need to plan their futures. Removing Title 10 services threatens that stability, leading to higher poverty rates, more reliance on public assistance, and fewer opportunities for upward mobility. Let's not dance around the bigger issue here, though. Autonomy is at the core of this. Title 10 isn't just a healthcare program, it's a tool for equity. It levels the playing field, giving people who've historically been marginalized a chance to control their own futures. Project 2025's attack on Title 10 isn't just about budgets or bureaucratic red tape, it's about control. By limiting access to contraception and family planning, these policies strip people of their ability to make choices about their own bodies and lives. For women of color, LGBTQ+ folks, and low-income families, this isn't just an inconvenience, it's a direct attack on their dignity and autonomy. And let's be real, these impacts won't stop with Title 10. The same ideology that wants to gut reproductive health care and also wants to roll back protections for LGBTQ+ individuals also wants to end birthright citizenship and erase discussion of systemic racism from schools. Title 10 is just the first domino. If it falls, what's next? This isn't just an isolated attack. Project 2025 is a full-scale blueprint to reshape the federal government, as I said at the beginning of the episode. They'll strip civil liberties and consolidate power under a conservative agenda. Title 10 is just one piece of a much larger puzzle. So let's take a brief closer look at what else this 900-page playbook has in store. Let's start with power. Project 2025 isn't just about policy changes, it's about consolidating power in the executive branch. If implemented, the plan would increase presidential authority to new and alarming heights. Think warrantless surveillance, increased targeting of journalists and protesters, and fewer checks on executive decisions. What does that look like in practice? Well, imagine a world where peaceful protests are monitored, journalists are harassed, and dissenting voices are silenced. Sound familiar? It's déjà vu from some of the darkest chapters of modern history. And this isn't just about security, it's about controlling narratives and stifling opposition. Next on the agenda, immigration. Project 2025 proposes gutting protections for immigrants by dismantling the asylum system, ending birthright citizenship, and enforcing mass deportations. If that sounds like a recipe for chaos, it is. These policies would separate families, destabilize communities, violate international human rights standards, and destroy the American economy. And here's the thing, it isn't just about border policy, it's about creating a culture of fear for anyone who doesn't fit into their narrow definition of who belongs in America. Immigrants, especially undocumented ones, are already among the most vulnerable groups in our society. Project 2025's proposals would push them further into the margins. And because attacking healthcare and immigration aren't enough, Project 2025 also sets its sight on education. Their plan? suppress discussions about race, gender, and systemic oppression in classrooms, because apparently acknowledging inequality is just too threatening and makes them feel bad. The goal here is clear: erase any progress we've made in addressing racism, sexism, and any other systemic issues. By banning these discussions, Project 2025 aims to create a sanitized version of history that ignores the lived experiences of marginalized communities. It's not just censorship, it's an assault on truth. So, what do these proposals all have in common? Control. Control over your healthcare, your rights, your education, even your ability to question authority. Project 2025 isn't just about cutting funding for programs, it's about reshaping the entire federal government to serve a conservative agenda. And the people who will feel the impact first and hardest are those already at intersections of systemic oppression. Here's the thing: Title 10 may seem like a small piece of the puzzle, but it's a critical one. If they succeed in dismantling it, it sets the stage for more sweeping changes that undermine equity and justice across the board. It's also the next step towards removing control of our bodies and revoking the rights to birth control in this country, which I've talked about in previous episodes. At its core, access to reproductive health care isn't just about medicine, it's about dignity. Title 10 gives people the tools to make informed decisions about their own bodies, their futures, and their families. Whether it's a young woman seeking affordable birth control, a transgender man needing hormone therapy, or a rural family accessing cancer screenings, Title 10 saves lives. And imagine a world where that lifeline is cut, where people are forced into crisis pregnancy centers that don't provide real health care, where reproductive autonomy is reserved for those who can afford it. That's not just inequity, it's injustice. And Project 2025 will not stop there. By targeting Title 10, it's setting the stage for a larger rollback of rights. When these communities are harmed, we all suffer. Public health crises don't stay isolated. Economic instability affects entire regions, and when education is censored, it creates a society that's less informed and less capable of addressing its own challenges. This isn't the first time progress has faced backlash. Throughout history, every step forward has been met with resistance. Think about the civil rights movements of the 1960s or the fight for LGBTQ rights in the 2000s. Every time we've expanded access to justice and equality, there has been a counter movement trying to claw it back. Project 2025 is just the latest iteration of this pattern. The history also shows us something else. Progress is resilient. It survives because people fight for it, because communities refuse to stay silent, that we do not fall to the bystander syndrome that someone else will speak up for us. Because individuals like you and me decide that enough is enough. If this project succeeds, the consequences will be devastating. More people will lose access to healthcare, more families will face economic stability, more rights will be eroded. And the message will be clear: progress can be undone if the opposition is loud enough. They're not counting on us to fight back, though. They're counting on complacency. They're counting on bystander syndrome, on people feeling overwhelmed, uninformed, powerless. And that's exactly why we can't let that happen. First things first, there are incredible organizations working to protect reproductive health care, and they need our support. Just like Planned Parenthood, the ACLU, and the Center for Reproductive Rights are leading the charge with advocacy, litigation, and direct services. They're fighting policies like Project 2025 every day, but they can't do it alone. So here's what we can do. We can donate. Every dollar counts, whether it's $5 or $500. Your contributions help fund legal battles, clinics, and educational campaigns. We can volunteer. Many organizations need boots on the ground, whether that's at a clinic, making phone calls, or helping with community outreach. And spreading the word. Share resources on social media, talk to your friends and family, and keep the conversation going on this topic. Supporting these organizations isn't just helpful, it's critical. They're on the front lines, but we are their reinforcements. Call your representatives. Lawmakers need to know where we stand. Whether it's your local representatives, your state officials, or your member of Congress, they work for you. And if they're not standing up for reproductive justice, they need to hear about it. And here's how you can get started on that. Find out who your representatives are. Sites like commoncause.org can help you figure out who represents you at every level of the government. Make the call. Don't overthink it, just pick up the phone. Tell them you oppose Project 2025 and any policies that undermine reproductive health care or Title 10. If talking on the phone makes you nervous, email them or use any number of online advocacy tools. And follow up. Keep the pressure on. Follow up on how your representatives vote and hold them accountable for it. Pro tip: get your friends and family involved too. The more voices they hear, the harder it is for them to ignore us, because this is all about getting reelected for them. And if enough people speak out, they're going to get worried. And also, stay informed. I know you're already listening to this podcast, so I'm preaching to the choir, but the folks behind Project 2025 are counting on people being uninformed and overwhelmed. But when we understand what's at stake, we can push back with facts, confidence, and clarity. You can stay in the loop by following trusted sources. I recommend some outlets like Guttmacher Institute and the ACLU. You also need to read the fine print. Take the time to understand policies, proposals, and the impact they'll have. The more informed you are, the better equipped you'll be to fight back. And share. Share what you learn. Whether it's conversation with a coworker, a social media post, a book club discussion, spread this knowledge. And please get involved locally. The fight for reproductive health care isn't just happening on the national level. It happens in your community. Look for opportunities to make a difference right where you live. There's a few ideas I can give you. Support local clinics. Many independent clinics rely on community support to stay open. Donate, volunteer, advocate for them. Join local advocacy groups. Organizations like the National Network of Abortion Funds have local chapters that you can get involved with. And attend town halls. Show up, ask questions, make your voice heard. Local politicians need to know that this issue matters. Change starts at home. We cannot be complacent. We can't wait for someone else to do the work. We can't only show up 6 months before major elections and expect to have an impact. We have to get messy and do the unsexy work of community organizing right now. Don't let the momentum die. The people behind Project 2025 are playing the long game. And so should we. Keep talking about Title X, reproductive justice, and why these issues matter. Show up to rallies, amplify marginalized voices, and never stop fighting. And remember, you're not alone in this. Whether it's grassroots organizing, online activism, or simply having conversations with the people in your life, every action matters. Together, we are louder, stronger, and more powerful than they want us to believe. That was true in the 1960s, it's true in the 2000s, and it's true today. We've seen time and time again that change is possible when we fight for it. Title X has survived attacks before. Civil rights have survived attacks before. And we can survive this one too, but only if we act. Until next time, stay bitchy, stay loud, and stay ready to fight for what's right.
Thank you for tuning in to hear me bitch about history. If you're loving the show, don't forget to subscribe and make sure to visit bitchyhistory.com to sign up for the newsletter. The newsletter offers extra resources on the topics covered in all of our episodes, as well as on the topics covered in my videos on TikTok. Supporting the podcast is really easy. Spread the word to your friends, grab some fabulous Bitchy History merch off our website, or consider becoming a paid subscriber. Your support means the world to us.
History.
History. History. History.
History.
What a bitch, right?